Hey, hello, my friends. Welcome to this live session on my YouTube channel. I'm happy that you are here with us today and listening to me one more time. I've been able to do this every Wednesday. For me, Wednesday is a good day, and I'll try to do this more often. So, thank you for those of you who are already here, and you know the drill. I ask you to add your name to the chat here and tell me where you are watching from. We already have Francis who said good morning. You are from Porter, Texas. Welcome here, my colleague, my friend, and Rodrigo Luiz Ferreira. That's a very Portuguese or Brazilian name. And Rodrigo is from Chicopee, Mass. I think that's Massachusetts. Welcome, Rodrigo. And welcome to anyone who is joining today. I'd love to hear where you are joining from. Which part of the world are you? I like to know where people are watching me today. Today, I brought a topic that I think it's an important topic. People don't talk too much, especially with their pain doctors. I am a pain doctor. I'm a physician. I work in Toronto, Canada. And sometimes we don't have time to talk about fear, avoidance, pain cycle. And this is such an important topic. I think if I ask more of my patients, almost everyone will have this problem with the fear avoidance pain cycle. And I'll explain to you what it is. And it is treatable, it is avoidable. And it's so paralyzing when we identify that the person is trapped in this cycle of fear, avoidance, pain, fear, avoidance, pain, fear, avoidance, pain. We can break that cycle and the person will feel so much better. And I tell my patients, this cycle just makes your pain worse. And because our reaction to pain is usually fear and avoidance, and sometimes the reaction to a disease, an injury, is worse than the disease itself. So that's what we need to treat, especially for chronic pain. Okay, so we'll talk about this today. Tonexi, hello, Dr. Furlan. You are in Redondo Beach, California. Oh, so I think it must be really warm there. Welcome here today. Thank you for joining us and watching us today. Yes, so before I start, I just need to say that this live event is not supposed to give you any medical advice. And this is just for education, okay? I want you to understand what's going on, especially if you have chronic pain, so you can discuss these things with your doctor, with your physiotherapist, with your nurse, with your psychologist, whoever is involved in the treatment of your chronic pain. I want people to be knowledgeable. You need to be the most knowledgeable person in the room. You need to know what you have, what's happening to you, so you can have a very productive conversation with your healthcare provider. So that's the intention of my videos. And if you don't have a diagnosis, if you're having pain right now, please talk to your doctor. I'm not your doctor. And if there's any emergency during this live, when you are watching this video, please go to the nearest emergency department or call an ambulance. And I know a lot of people watch the replay of this video. It looks like it's live, but if you are watching this after today, because you could not catch up the live session, it looks like I'm talking live to you, but it's actually a replay. So please, yeah, Rafik, so cute doctor. Thank you so much. So let's talk about fear. Fear is an emotion. It's a normal emotion we all have. So why should we talk about fear? If you remember the 8 steps to conquer chronic pain, the second step, if you had a chance to read my book, if you didn't, I will explain to you what it is. So the second step of the 8 steps is actually about here. Step number 2 is control your emotions. Why did I put emotions right in the bottom of the mountain? So my book, I compare conquering chronic pain with conquering a mountain, like a mountaineer that is going up the mountain, right? And controlling your emotions is right here at the bottom of the mountain. This is the same thing as a mountaineer that, decides that they are going to escalate the Mount Everest, or they're going to go up any mountain. They need to prepare mentally before they start jumping the mountain, right? Before they start climbing the mountain. They need to have their gear, they need to buy stuff, they need to prepare their food, their nutrition. They can't just, a climbing mountain expedition is a couple of days, sometimes weeks. So they need to be prepared. And preparing emotionally is very important. Imagine if someone is going to climb a mountain and they are fearful of falling, fearful of the winds, fearful of the cold, fearful of the animals. They cannot even start. So this is why I put control your emotions at the bottom of the mountain. Conquering, if you want to conquer your chronic pain, the second step is control your emotions. And one of the emotions, what are the emotions that I talk about here? So the emotions that we talk in this chapter could be fear, it could be, and I'm talking more about the unhealthy emotions, because emotions are emotions. We should not try to abolish or suppress our emotions because it's impossible. Our body or mind is connected and we have emotions. It's part of being human. We cannot suppress, we cannot abolish them. We cannot say, no, I'm not going to have this emotion anymore. What we need to do is, if we have fear and fear of pain, and fear of pain is usually paralyzing, chronic pain, okay, we'll talk about this. You cannot say, I'm not going to have fear of pain, because you're going to have it. It's natural, but you can control that fear. So I give here in this chapter some examples of unhealthy feelings or emotions that kind of they block our rehabilitation of pain, chronic pain. If a person is stuck on those emotions, unhealthy emotions, they're not controlling, they are not evaluating, they are not treating those emotions with tender, loving care. First, identifying those emotions, realizing, validating them, and then seeing what is the meaning of that emotion. That's what I call controlling your emotions. They will be stuck. They will not conquer chronic pain, okay? So what are some examples of those unhealthy feelings or emotions? Being afraid, angry, devalued, forgotten, guilty, helpless, hopeless, lonely, lost, rejected, sad, stressed, tired, unsafe, weak, worried, and worthless. You see, this is in alphabetical order. So we'll talk today about being afraid. That's the first one. And on page 94 of my book, The 8 Steps to Conquer Chronic Pain, we start talking about fear. Okay. So I'd like to welcome, Rachel's son. Hello, Rachel. Welcome to be here. Thank you for watching today. So what is fear? First of all, fear is very natural, but fear is unpleasant. Well, some people like to feel fear in a controlled situation, like those roller coasters that, it's safe because those roller coasters make you feel fear, but it's safe, it's controlled, it's made by a human being. So some people like to feel fear. They like to be exposed to fear. They get some adrenaline and they get some dopamine and serotonin in the brain when they have fear. So that's why some people are even addicted to fear. But that's another problem. Normally, we don't like to feel fear. It's an unpleasant sensation because it puts us in danger, right? So at the beginning of this chapter, the Control Your Emotions, I talked about two cases, Sarah and Carlos, that they were paralyzed by fear. Their life was paralyzed because they were fearful of, one was fearful of speaking in public, and Sarah and Carlos was fearful of his morning meetings. So this paralyzed their careers. They couldn't advance. They couldn't apply for a better job because, like, Sarah was afraid of speaking in public, and Carlos was afraid of meetings, morning meetings. So they had headaches, they had pains because of those fears. So fear is produced in our brain, and there is an organ in our brain called amygdala. Amygdala is a center of our brain, it's a tiny little area that is the fear center. So we know a person is fearful if we can take a picture of their brain, and we need to do a functional MRI, because just a normal MRI doesn't show which areas are functioning, which areas are light up. It has to be a function MRI, because a function MRI will show which areas of the brain are consuming oxygen, therefore they are activated, right? So in a function MRI, you see when a person is fearful, you expose them to fear, the amygdala, poof, light up. So we have a center in our brain, it's called the amygdala. There are some people that they have a disease of fear. They have excessive fear for tiny little things that are not dangerous. And sometimes, and that could be like obsessive compulsive disorders, or people who have panic attacks, or people who have phobias. They have phobias of tiny little animals like spiders. A tiny little house spider is not dangerous, but some people cannot even look at them. So that's an excessive fear to a tiny little thing. And that needs to be treated. So people may have anxiety attacks, panic attacks, and these are, or obsessive compulsive, or post-traumatic stress disorder, that they had a frightening experience in the past. Like this could be something that was life-threatening to them. This could be something that was, they were exposed to an acute assault, or a war, or an emotional event that was very traumatic. And that's natural to have fear during that event. But 6 months later, 5 years later, 20 years later, when you are not in danger anymore, if the person still is having that fear or memories of that situation, that's post-traumatic stress disorder, and that has treatment. Okay, but we're talking about a different kind of fear here. We're talking about an excessive fear to pain, and why that happens. So naturally, when a person has pain, pain is a sensation, and it's a sensation coupled with an emotion. So in our brain, when we feel pain, the areas of the sensation and the areas of emotion, the limbic system, they activate at the same time. We can't block that. It's just, again, it's part of how we are designed. It's how the pain system is designed. Okay? So then what happens is, in acute, this is done the reason why this is coupled in the brain, a sensation called pain and an emotion, fear, anger. When a person has an acute pain, they need to be fearful. They need to be afraid of that sensation because they need to protect themselves. They need to avoid a situation. Let's say that if they are burning their hand on a fire or on a hot stove, they need to be afraid of that, because if they're not going to remove their hand from the stove, right? So what happens is, if the person is not fearful, they will not protect themselves. But this fear is only helpful when the pain is acute, when there is a danger right there and they need to avoid. But in chronic pain, there's no more danger. Where is the danger? If a person is having fibromyalgia and they have pain all over their body, where's the danger? There's no danger. So why the brain is still activating the areas of fear, the amygdala? That's what we need to separate. That's what we need to do to uncouple. So there are a lot of chronic pain situations that the fear is not helpful. Actually, the fear is paralyzing. And if the fear is paralyzing the person because the fear is telling the person, don't do this, don't go there, don't do this, don't move, stay quiet, don't exercise, don't do this, the person will start limiting what they are doing. And by limiting what they are doing, guess what? They will be less active, they will be less productive, and they will not be doing things that are helpful for them. Actually, I have the journal, my new book, You Are Unique and So Is Your Pain, which is a lot of activities here, 90 activities for the person to write down what they're doing. One of my goals in writing this book is to help the person to identify their fears. What are the things that they are not doing because they're fearful of the pain? So I will ask the person in this book to write down, to think about, am I in this situation? Am I in this fear, avoidance, pain cycle? And here is a picture of the fear, avoidance, pain cycle. So in the book, this is page 95 of the 8 steps to conquer chronic pain. You see here that the person has an injury. So it starts with an injury, but then if they get to this cycle here, they have negative, they have fear, they have negative thoughts about what's going on with their body. They have the fear of pain, they have pain anxiety, and then they avoid doing things, and that just paralyzes them even more. What they have to do is they have to have low fear, confront the problem, and then they will heal and recover. This is usually what the athletes have. So when you see an athlete, I see a lot of those. I don't watch a lot of sports, but sometimes I hear about soccer players, basketball players, volleyball players, football players. They had severe injuries. So they had a very severe injury. But instead of getting to the cycle of fear avoidance, because if they get to the cycle, they will not be able to go back playing. What they do is they confront their fears, and then they confront the problem, and they heal and recover faster. So how can a person do this? I say, well, it's easy to say, but is it easy to do, especially when you're having pain? So it's really important that the person will work with their doctor, their physiotherapist, and ask, is it safe for me to move this body part? Let's say after an acute injury. So of course, the soccer player would not start moving a knee or an ankle. If they have a fracture there and they are immobilized, they're in a cast, the doctor and the physiotherapist, they will say, no, it's not time for you to move. You have to heal that bone. But as soon as they remove the cast, guess what they do? They have pain. Yes, they have pain. But they move and they start the rehabilitation because they need to start playing. But what I see my patients doing is when they remove the cast, the injury is healed, the bone is perfect, they move and they stop. Oh, I can't move because I have pain. So that is the fear, avoidance, pain cycle. We need to break that cycle. I can't stress enough. And now imagine that my patient that had a knee injury 2 years ago, still today doesn't want to move that knee because it hurts. And I have to convince that patient, your knee is okay. You can move. You don't need to be afraid of the pain. Oh, but it hurts. I know it hurts, but it doesn't serve you any purpose to avoid moving. You need to move. So we need to work with them in their mind and in their body. In the mind, we need to say, you need to convince yourself, convince your amygdala, that's the amygdala inside of your brain, that fear does not need to be there. And maybe your amygdala now became so trained and so good at lighting up that sometimes it lights up even when you think about moving that knee. Believe it or not, I have some patients that I ask them, I say, can you think about moving the knee or the lumbar spine or the neck, the shoulder, whatever it's hurting? I say, just think about moving that body part. Just think, imagine that you are doing that movement. And they say when they imagine, they feel the pain. I said, yes, because it's a conditioned reflex now that you created in your amygdala. Your amygdala is trained. Move that, pain, fear. You can break that by thinking differently. Okay, so you need to retrain. And how do you do this? You are going to work with a physiotherapist or someone that will tell you, a personal trainer, a kinesiologist, and you are going to say, I can move that body part. I can move my lower back. I can move my neck. If you have fibromyalgia, you can move your whole body. If it hurts, it can be for two reasons. It's because you are deconditioned and you are having the muscle soreness, that's the delayed onset muscle soreness, DOMS, that we all have when we exercise some muscles that we are not used to. You don't need to treat that. It goes away in 48, 72 hours. Or it can be because your pain system is malfunctioning. You're not producing enough endorphins to block that pain. So you need to start a gradual intensity and gradual duration of exercises. And I have a video for that on my YouTube channel. I have a video that I talk about how people can start a gradual retraining of the pain system. Because if they do exercise and it hurts, it just reinforces in their brain that they're doing something dangerous. Oh, I should not be moving. I should not be exercising because I get this message that it hurts. And if it hurts, I must be doing something damaging my body. So in chronic pain situations, not more than 90% of all chronic low back pain is considered primary low back pain, which means you can move it. It's not secondary to a disease of the lower back. Less than 9% of all low back pains are secondary to something. And this something could be serious, but even if they have a serious problem in their lumbar spine, except if it's a fracture, let's say there's an acute fracture in the spine, you don't want to move it. But even if you have a nerve impingement, if you have an infection in that spine, you can move, you can do some movements, but treat that infection or fracture. But those are so rare. The majority of chronic low back pain is primary chronic pain, which means there's no structural problem causing the pain. The pain is coming from a malfunctioning of the pain system. So yeah, let me see. There are more people who joined. I was talking here and I didn't see the chat. Teresa, hi Teresa Crowley. Caesar, you're calling from you're in Caesar. You're Caesar from Cairo in Egypt. Wow. Sonal, Walei Fish, yeah, makes sense. Thank you. Mika, Vermeering, and Leslie Phelps, good morning for California. Yeah, thank you so much for watching today. That's great to see you're here. So tell your friends about this because I think people don't understand. Fear avoidance is good when we have an acute injury and you need to protect that body part that is hurting. But when you have a chronic pain that is mainly nociplastic or a primary chronic pain, there's nothing to protect there. The fear to protect that area is only going to make it worse. And again, I mentioned this and I talk more about the fear as an emotion. There are some behaviors that a person will experience. And there is even a questionnaire that it's called the Fear Avoidance Beliefs Questionnaire that was published in 1993, that they have some questions to see, is this person having a lot of fears? So sometimes we may use that questionnaire with our patients in chronic pain to see, and then we can classify this person is really high on the fear avoidance pain behaviors. We need to talk to them to prepare them to climb the mountain. Because again, I showed you in the beginning, controlling the emotions is at the bottom of the 8 steps. If the person does not control their emotions and if they can't first identify that fear is paralyzing them, if they cannot control that emotion, it's going to paralyze them because their reaction will be much worse. Yes. Hi, Mika, and hi, Sonal. Welcome here. I have a video on my channel, very interesting. I interviewed Jane Plenty. It's video number 182. I'm going to put here in the chat. So Jane Plenty is a person who lived with chronic pain for about 37 years. And she tells her story in this video that I interviewed her on my channel. And she talks that one day she realized she was paralyzed by her fear of chronic pain. She couldn't do anything. Her life was totally miserable. The only thing she could do was lie down in the floor of her kitchen. She couldn't travel by car. She couldn't bike. She couldn't do anything. And then she Googled fear of pain, and she realized that's what she had. And then she tells her story, how she found someone that could help her to remove this fear of pain after 37 years. And now Jane has been, I would say 3 years now has passed, and she's living her full life. She tells me she can do anything she wants. There is no limitation. Sometimes she has a little bit pain here and there, but it doesn't paralyze her anymore because she lost the fear of pain. She broke that cycle after 37 years. So I don't want anyone to lose 37 years of their life. Your life is too precious. Okay, every day that you have is too precious. I don't want people with chronic pain to lose this because they are in this cycle, the fear avoidance pain cycle. And that's what Jane was. And if someone here has a fibromyalgia or pain that is more like a primary type of pain, that is, how do you know that you have primary type of pain? Is because you have pain that is inconsistent, it's more nociplastic, it's spreading to your body. One day is in one body part, another day is in another body part, it's affecting the sleep, it's causing depression. So this is probably more a primary type of pain. If a person with primary pain, they try to do exercises, they may have more pain because their pain system is not functioning. So there is a video I talk about, how a person can pace and gradually increase the amount of exercise. That's video number 94 on my channel. Yes. So, yes. Hi, Nirmala. Thank you for attending today. So I can't give medical advice because I don't have all the details, but I would advise you to talk to your doctor. But now, with all this knowledge that you have, now you are more knowledgeable and you can for sure discuss these things with your doctor, maybe with your physiotherapist, and ask, am I suffering of too much fear of pain? Maybe your physiotherapist will be able to use that questionnaire with you and say, yes, you are, your fears are very high on these questionnaires, and we can treat that. And because you will feel so much better after you are free from that fear. I find that these are people who they create a jail for themselves, not intentionally. Like the person is not trying to do this on purpose, but they create that jail and they put a lot of limits what they can do. That's what Jane did for 37 years. She tells her story in this video that I put there, video number 182 on my channel. So I feel very sorry for those people when I see them in my clinic, because I say, this is not necessary. You're suffering unnecessarily. Your pain can be much better controlled if you get out of that pain avoidance cycle. And for those of you who don't know, I just released my new book, You Are Unique and So Is Your Pain. It's already on bookstores, in the shelves, and I'm going to do some book signing events. My first book signing event will be May 4 and 5. May 3 and 4, Saturday and Sunday, at the Canadian Pain Society in Toronto. So if you're coming to the Canadian Pain Society, if you're in Toronto, you have an opportunity to come to the Canadian Pain Society. There are a lot of people with chronic pain who attend the conference. We have special events for people with lived experiences of chronic pain. You are welcome to attend. If you are in Ontario, you are more than welcome to attend and come. And then you will see me at the booth and I can sign you a copy of my new book, or my other book, my first book, The 8 Steps to Conquer Chronic Pain. And you can find my book in any online bookstores or any bookstores where you live. If you live in a country that you can't order, maybe go to your bookstore, local bookstore, and ask them to bring the book for you. I'm pretty sure they will do this for you. Thank you so much for all of you who attended today. Nesrin, Sonal, Nimala, Nika, Leslie, and Wally, Cesar, Teresa. A lot of people attended today. Thank you so much. Tell your friends about this channel, and I'm trying to do a live session every Wednesday here on this channel to discuss topics that are important for you. And if you have any suggestions of topics, you may write in the description of this video in the comments below, and tell me what topic you would like me to do a live session next week. Thank you. Goodbye. See you next week.